Hi, I'm Colleen, and today I just want to answer a quick question that I get from a lot of people I talk to who are either thinking about quitting drinking or trying to decide that if they do quit, how long they're going to quit for. And the question I get is, will I be able to go back to normal drinking? And so I want to talk about first the word normal and what that means. We usually only apply it to problematic behaviors to justify some sort of something that isn't working for us. We're trying to rationalize a behavior that isn't working. And in reality, nobody wants to be normal. When it's time to apply for the job or take the test or compete or date or raise your children, you want to excel. You want to be better than average. And in reality, I think we're confusing the word normal with common or average in this society. We use the term normal drinker because so many people drink. Well, think about the fact that it's really not healthy to be normal. In America, 80% of us are on some medication, and half of us take on average 4 medications per day. 75% of us are overweight. Half of us can't sleep. Most of us have stress that is debilitating to our physical or mental health enough that it affects us. 80% of us drink, and 1 in 4 of us are drinking too much. So if that's normal, why are we holding that up as some sort of ideal that we want to strive to become? Wouldn't it be better to decide to rise above all of that, and go for the life of our dreams instead of settling for this normal concept that isn't really serving anybody? And so the question is, where does this concept of normal drinking even come from? And the truth is, it kind of comes from 2 places. Number one is big alcohol, because they're trying to sell a product that's a class 1 carcinogen and highly addictive. Alcohol is a mood altering depressant drug whose withdrawal effects include agitation and apathy. It's also a highly potent neurotoxin that interferes with our executive function and our ability to regulate our emotions. And not just when you drink. The more you drink on a regular basis, the less you're able to make qualified, rational decisions. Did you know that one bottle of wine, every bottle of wine, is the equivalent of smoking 10 cigarettes in terms of cancer risk? That's a little known fact. You buy a carton of cigarettes and it says this product may cause cancer, and yet the only label you see on an alcohol label is please drink responsibly. So big alcohol, in combination with the traditional AA approach that there's normal drinkers and then there's alcoholics, those 2 groups are kind of bringing all of us to this belief that somehow if you drink too much and you're susceptible to the addiction, that somehow there's a problem with you instead of the product itself. So we're demonizing, people who get addicted to a highly addictive substance. And when you think about it, we don't do that with other products in our society. Think about illegal drugs like heroin or cocaine. We don't ever say, well, if you could just use that normally, you would be okay. Clearly, there's a problem with you. So, we don't say that you're a heroinaholic or a cigaretteaholic or whatever. We refer to it as a cocaine addiction. Yet we talk about alcohol addiction in terms of alcoholic. So there's something wrong with the person, not the product. It's a very effective marketing tool, but ultimately, we're all suffering because of it. And so we've normalized drinking in our society. And what I invite you to do today is think beyond that little tiny box. Do you want to be normal, or do you want to stop, using a substance where you're tying your hands behind your back, shooting yourself in the foot, and then trying to live the life of your dreams, and then wondering why you don't feel great and why you feel stagnant and why, your emotions are all over the place and your relationships are struggling? Well, that's probably, if you're drinking on a regular basis and you remove alcohol, those things will probably begin to resolve themselves. And also, you'll have the bandwidth to resolve problems in a rational, positive way, instead of just deciding that you're going to rely on alcohol to cope or to ignore it, or all the things that we use alcohol for. So just think about why you would ever want to be a normal drinker, and help me begin to normalize sobriety. It's not normal to want to drink a poison. If you drink too much alcohol, your body literally throws up to save your life. And that's not anything that serves you in even small amounts. And so you get to rise above that if you want. So if you're ready to ask the question of yourself, not am I an alcoholic, but would my life be better without this normal problem that everybody else seems to be managing and it's not going well for me? If you are, join my private Facebook group, Normalize Sobriety, where every day I'm posting motivation and education and inspiration, and we're having conversations about what we really want to be normal in our lives. I'll see you over there.